Everyone. As I quickly mentioned upstairs as well, we're joined here by three brothers that have been kind enough to travel from Indiana to come and talk to us about Social Security and Medicare. They're from the Ikhlas Insurance Group in Northern Indiana, I believe in the Maryville area. They specialize in the area of Social Security and Medicare. They'll also touch upon the topic of Obamacare. It's a topic that's, I think, near and dear to all of us and will apply to us at some point in time, inshallah. So it's a great opportunity for you to listen to what they have to share with us and ask them questions. They'll be here for about an hour and a half. We'll be serving some refreshments in a short while. This event is being live streamed on YouTube, and we do have the ability for you to post questions online using Slido, and we'll share the access code with you. And the access code for Slido is it's pound 3320577. Pound 3320577. You can go to Slido online, post your questions using this access code. We'll get your questions online, and the brother over here can address it. So with that, let me pass it over to Brother Osama. And inshallah, we'll take it from there. Jazakallah, thank you for joining us.
What's coming?
There you go.
Assalamu alaikum wa rahmatullahi wa barakatuh. Bismillahirrahmanirrahim. Wassalatu wassalamu ala sayyidina Muhammad wa ala alihi wa sahbihi ajma'in. I'm very happy to be here with all of you. Alhamdulillah. Jazakumullah khairan for inviting us to share with you and to inshallah educate your community on two very, very important subjects. Now, these subjects are not very fun. So I ask you to bear with me inshallah as I try to make it as exciting as possible. This subject is also very hard for people here that are born in the U.S., living their whole life in the U.S. to understand. Now, for me, my name is Usama Aswani. I'm one of the partners at Ikhlas. And I've been in the insurance industry for about 15 years now. And me and one of my partners, Khalid, when we started the company, we started it about 2017, 2018. We saw there was a big need in the Muslim community for help and assistance in these in this market. Specifically for a lot of our uncles and aunties that came from overseas that are not aware or familiar with benefits that they could even be eligible for, even if they did not work here in the U.S. Right? Now, obviously, if you've been here in the U.S. and all of these things, we're going to go over all of these different matters. But there also can be things that you can be eligible for that many people are not aware of, right? And sometimes it can be very daunting to contact Social Security and Medicare and all of these things, and not knowing how to navigate through this. So inshallah, with this, we give you some basic information to educate you on the Social Security and Medicare benefits. And then also, we're here to assist you, anything you need. Our main office is actually based here in Illinois, out of Westchester, Illinois. Alhamdulillah, we work nationwide. Now we do live in Northwest Indiana, but alhamdulillah, we do operate nationwide. And we do visit masajid around the U.S., helping educate our Muslim communities and our elders specifically about these subjects. So inshallah, we will begin with Social Security. Now, first and foremost, the most important thing for someone who wants to retire and to understand, they want to know how much benefits that they will collect in Social Security, or how to even collect a Social Security benefit, right? As you know, once you reach a specific age here in the U.S., you can collect a monthly check from the government, which is your Social Security check, that you will receive to help you, assist you through your retirement. So how do you become eligible for something like this? So first and foremost, you require a minimum of 40 credits in order to be able to qualify for that Social Security check. One credit, you're eligible to get one credit in each quarter of the year. So there's 4 quarters in a year. So it's broken down from those 4 quarters. You have to make a minimum of $1,730 in each quarter in order to qualify for a full credit, which is really not that much, right? So it's not difficult to get to receive the credits. So receiving 40 credits, and if you essentially how that breaks down to, it breaks down to about 10 years of working here in the US. Now, if you only work for 10 years and you achieved your 40 credits, that means you will be eligible for a Social Security check, but it's not going to be very high. And I'm going to explain that in a few more slides. Honestly, the best way to figure out what your Social Security benefits is going to be is to go to the Social Security Administration website, ssa.gov. Now, there's this other link where you can estimate how much you make, but to be honest with you, the best thing to do is to go to ssa.gov, the government website, to create an account, sign up and make an account for yourself. And then from there, the government website has a program where you can punch in when you want to retire. Let's say you want to retire at 62, 65, 67. It will let you know how much your Social Security check will be if you collect it at that specific age, right? So that is very important, especially if you're working and you want to be prepared for when you retire. So you know how much money is going to be coming in on a monthly basis to, inshallah, cover your day-to-day expenses. So one of the most important questions is, when can I begin collecting my Social Security? Now, there are other circumstances where you can collect earlier than this, but generally speaking, the age where you begin collecting your Social Security is at the age of 62. Now, if you begin collecting your Social Security at the age of 62, there will be a deduction in the benefit, right? In order to get the full benefit that you're eligible for, you would have to wait for your full retirement age. Now, your full retirement age is different for many people. So when we get to that slide, pay close attention. But you are eligible to begin collecting at the age of 62 as early as that, but keep in mind it's going to be at a reduced amount. How can you maximize your Social Security check to receive the highest amount? You maximize it by waiting to collect your Social Security check at the age of 70. So if you wait until the age of 70, then you'll get the maximum amount, right? There's no reason to delay collecting your Social Security check beyond the age of 70. So one of the main questions is, well, when should I collect my Social Security check? Should I collect it at 62? Should I collect it at 60, at my full retirement, or anything like that? Well, it really depends on your situation. It's a case-by-case scenario. So this chart here shows you what your full retirement age would be, okay? So if you were born, the full retirement age used to be age 65 for everybody. But what happens is the Social Security Fund is running out of money. Because the Social Security Fund is running out of money, the government needed to do something to reduce the amount of people that are collecting Social Security checks. How did they do that? They did that by delaying the Social Security age in order to collect your full retirement benefit. Okay? So some people want to wait for their full retirement age in order to collect because they've been working for so many years, they want to make sure that they get the highest check. And also many people, generally speaking today, because of inflation and how expensive everything is, people are actually working later in their years and they're waiting for their full retirement age. So if you were born from 1943 to 1954, your full retirement age is the age of 66. So anytime between 1954 and 1959, okay, you add 2 months to that. 55, 56, you're adding 2 months to that. So I know there's a little typo here on the screen. It says 1958 twice, but the second one is supposed to be 1959, right? So you add 2 months until you reach 1960. If you were born in 1960, I believe people that were born in 1959 right now are turning 65, right? So 1960 or later, the full retirement age is the age of 67. Now, is it possible that the government might extend this in coming years? It is very possible. Why? Because actually, Social Security, again, is running out of money. There is even a study that was done that by 2034, Social Security would only be able to pay about 30% of what you're eligible for. And after that, they're basically saying that the Social Security Fund would be zero, and they wouldn't be able to afford to pay anything. Now, is the government going to allow something like this to happen? Honestly, I doubt it, because Social Security has been a staple in the US for a very long time.
So there will be things that change in the government, such as potentially higher taxes, right? That are helping people pay into their Social Security. So this is a very important age to understand. And honestly, beyond this, again, having an account on the Social Security website is so critical and crucial in making that decision of when the best time is to collect your Social Security check. Because you get to see visibly, okay, my Social Security check is going to be $1,000 a month, $2,000 a month. Now I know how to prepare for my retirement, inshallah. So what will you receive in Social Security benefits at what age? So as we said, the earliest you can collect is at the age of 62. That's the earliest you can collect it. Now, how will your benefit be reduced? It can be reduced anywhere between 25 to 30%. Okay, so whatever your full benefit would be at the full retirement age, if you collect at 62, it's going to be up to 25 to 30%. So what that means is if you collect at the age of 62, you're going to have a 30% deduction automatically from your full retirement age. That percentage decreases as you get closer to your full retirement age. So for example, if you collect at the age of 64, then maybe the percentage might be like 27% or something like that, right? The closer you get to it, it goes to your full retirement age. Now, if you wait for your full retirement age, and again, it depends on this slide that we had right here, whatever your full retirement age is here. So if you wait till your full retirement age, then you collect your full amount. Now, if you decide to delay, let's say, for example, mashallah, alhamdulillah, you've prepared for your retirement well. You had good investments, you saved a good amount of money, and alhamdulillah, you are not in need of your Social Security check. At that point, you can delay collecting your Social Security, and your Social Security benefit will increase, guaranteed, 8% every single year until you're the age of 70. 8%. Now, there's no investment that you can put your wealth in that can guarantee you an 8% return every single year. There isn't, right? Sometimes it may go higher, but sometimes you may be in a loss in investment, right? So if you don't need the money, it's better to delay it. And of the other benefits is when we begin talking about survivor benefits. Survivor benefits is like, say, for example, you pass away and your spouse can collect from your Social Security. So the earlier you collect, you're also reducing the amount from your spouse who's collecting from your Social Security, right? So if your spouse did not work, that doesn't mean your spouse is not eligible for Social Security benefits. That means they can be eligible from the breadwinning person in the household, right? So then they'll be eligible from that. But the percentage that they take is reduced based off of when the breadwinning spouse collects it. So sometimes one strategy that people think of is, you know what, I'm going to delay it for my spouse, because if I were to pass away or something like that, then they get it. But then obviously you have the other strategy where people say, well, I don't know when I'm going to die. I could die tomorrow. So why don't I just take the money now and use it for myself, right? So it's a case-by-case scenario. That's something that, we could assist you to try to figure out what would be the best solution for that. So what is the average Social Security check? So throughout the U.S., the average amount that people collect in Social Security check is $1,907 a month, which is decent. Now, many of you here might be like, well, that's not what I'm collecting. I probably collect 500 or 700 or 800. This is the average, okay? Now, the maximum you can collect in 2024 is $4,873. MashaAllah. Imagine collecting that much from the government every single month, right? Now, what is the deciding factor from Social Security, whether you qualify to receive the average amount or you're getting so much less, or you could potentially qualify for the highest, about $4,800. So essentially what's happening here is for all of you, that work, mashallah, you notice when you look on your pay stub, the government takes out for two things, right? They take out for a lot of things, but here we're talking about two things in specific. They take out for your Social Security and they take out for your Medicare, right? So keep this in mind when we talk about Medicare benefits. So when they take out for Social Security, they're taking out 6.2% from your paycheck. Now in 2024, once you earn in a year, right? Once you earn in a year $168,000, and that's $168,600, they will no longer collect that 6.2% or that 1.45% for your Social Security or Medicare, right? Your paycheck, you'll notice, actually become bigger because you're not paying into Social Security or Medicare anymore. right? Now what happens here? How do they calculate your Social Security benefits? They take your income for 35 years. So this is something that a lot of people don't understand. Sometimes you may have come from overseas, mashallah, doctor, engineer, whatever, or if you're just a very wealthy business person, you're thinking, man, I made well over $168,000 a year. I made the maximum. How come I'm not getting the maximum Social Security benefit of $4,800? The reason why is maybe you didn't work in the US paying taxes for 35 years. Maybe what you did is you only worked in the US for 10 years. Because what they do is they take your average income in a 35-year period. So if you only work 10 years here in the US, what are they going to put as your income for the remaining 25 years? 0. So when your income for the remaining amount is 0, that's going to bring down your average significantly. Therefore, you're not going to qualify for that $4,800 Social Security check. You're only going to qualify maybe $800, $1,000 if you're lucky, right? So just because you made a lot of money for 5 years, 10 years, 15 years, maybe even 20 years, it doesn't necessarily mean that you're going to qualify for that amount. Because if you didn't work for 35 full years, any difference in that is put as 0 as income, and it brings down your benefits. When do most people collect Social Security? So we have a chart here. There is these numbers from comparing men and women when they collect their Social Security check. As you see, the majority of women in the U.S., they collect it at the age of 62 when they're able to collect it right away. Men, it's mostly between the age of 63 and their full retirement age, right? So, but again, this really doesn't matter too much. Our main focus should be about our own personal situations and to figure that out. Now, every single year, your Social Security amount will increase. Now, in 2024, the Social Security amount went up by 3.2%, okay? Now, that may seem like a small number, but in the past, it's only gone up like 0.08%, right? So this essentially, as we all know, the cost of living inflation has been very high within the past few years, you know. So it's gone up 3.2%. So if you're someone on Social Security right now, and you're noticing that your increase is coming, it's because of the cost of living increase. Now, something that is very important to be aware of when you want to begin collecting your Social Security is to know how working can impact your benefits, right? Because if you say, for example, I want to collect at the age of 62. My life is in the hands of Allah subhanahu wa ta'ala. I want to collect the money now, give it to my family, instead of it just disappearing, and I'll never collect it, right? So I say, I want to collect it now. But something that you have to realize is the government may penalize you for earning income. How do they penalize you? And this is based off of your individual income. It's not household income, it's your individual income. So how they penalize you is if you collect your Social Security check any time between the age of 62 and your full retirement age. If you make more than $22,320 in that year, they will penalize you, or they will want back from you, from your Social Security, $1 from every $2 earned beyond that. So if you're working and you're making more than that amount, obviously we advise you to delay collecting your Social Security, right? Now, in the year of your full retirement age, okay, they give you the ability to earn up to $59,000, close to $60,000. Now, keep in mind, these numbers, the $22,000 and $59,000, this goes up every year, okay? They will penalize you $1 for every $3 earned beyond that. Now, this time period is very short, actually. But once you reach your full retirement age, so if your full retirement age, when we go back to that chart, is it 66? Is it 66 and 6 months? Is it 67? Whatever it may be. Once you reach that age, the full retirement age, there's no deduction, no penalty. So for example, if you want to make $1 million a year, mashallah, they're not going to reduce your Social Security check, right? You can make as much as you want. So that's why some people, especially if they're working, they'll wait for their full retirement age, because sometimes they'll be surprised. I have to owe all this money back to the government. Spousal benefits. A lot of questions that we have, especially in the Muslim community, right? MashaAllah, especially our sisters that dedicate their lives to raising, great Muslim men and Muslim women, that dedicate their lives in taking care of their home and they didn't work or anything, doing the greatest job that anybody could do and sacrificing for their family, right? Sometimes they think, well, I didn't work, so am I going to qualify for Social Security benefits? The answer is yes, because you get to qualify from your husband, right? Or if there are circumstances where the husband is not working and the wife works, right? So it's about spouses. So whoever is earning the income, you can collect from the higher person, right? So, for example, if the spouse did not earn any income, okay, the spouse did not earn any income, then the spouse can do what? They can collect from the breadwinning spouse in the family. They can collect 50% of their amount at full retirement age. 50%. So let's say, for example, the benefit for the spouse is $1,000, the full benefit. But the spouse decided to collect early, so they're only collecting $600. So now you're impacting the 50% for your spouse as well. So that's why it's very important to know when to collect, especially if your spouse did not work, because you're reducing their benefit as well. Okay? So that's something that you have to keep in mind when you make a decision. Now, there's no benefit reduction if they wait until full retirement age. Okay? So again, like in the last line, benefit can also reduce if spouse is earning too much. So that goes back to here. If the spouse is earning too much, then benefit will reduce. So it goes back to working and all of that. So collecting from the age of 62 between full retirement age for a spouse that's collecting from the breadwinning spouse, it would be it could be anywhere between 35 to 49%, right? So if they collect at age 62, then they're collecting 35% of their spouse's full benefit. Okay? And then every year you add to that, it can be up to 49%. But if the spouse that didn't work is waiting for their full retirement age, then they will collect the full 50%. Now, can a spouse collect greater than that? Yes, they can. And Social Security survivor benefit. Social Security survivor benefit is different. Especially, we see this in the Muslim community a lot. There's a bigger age gap, a bigger age difference between husband and wife, right? So sometimes there's a bigger, sometimes it's less, but we see a lot of cases where it's bigger. So especially if it's bigger and there's a 5 to 10 or beyond years difference between you and your wife, you might want to delay it because their survivor benefit could be significantly higher by you delaying your Social Security benefit. So delaying it is going to be better for your spouse who would be a survivor. Because if you were to pass away and you were the breadwinner in the family, your spouse can begin to collecting survivor benefit as early at the age of 60. So it's not 62 anymore. They can collect it at the age of 60. Now, if they collect it at the age of 60, if they collect it at the age of 60, they can collect up to 71.5% of the full benefit, right? So if they wait for full retirement age while you're alive, then only getting 50%. But at the age of 60, even earlier, if their spouse had passed away, they can collect more. Now, if they wait until their full retirement age, they can get the full benefit of their spouse, whatever that benefit is, right? So this is why it's very important to consider your family situation before collecting your Social Security benefits. So this goes to collection strategies, right? What is the strategy to figure out what is the best thing to do when it comes to how to deal with your Social Security, right? You have to strategize. You shouldn't just be like, I'm 62, I'm eligible to get a $500, $1,000 check or something like that. Think about it first, right? Speak to someone who can help you. And with us, alhamdulillah, when it comes specifically when it comes to Social Security, there's no charge or anything like that. We're just here to help the Muslim community to the best of our capacity. One thing before we go into Medicare that we need to know about Social Security. Can you be eligible for Social Security if you never worked in the U.S. and you just came from back home? You came from overseas. The answer is yes, especially if you have no assets. Okay? There are certain tricks that you can do, right? And if you're living with your children, right, you can even put that I'm paying my child rent even if you're not, right? And you can even be eligible to get around $700 a month in Social Security as a senior, even if you've never worked. And you'd be even eligible for Medicaid, and that Medicaid will cover the cost of your Medicare. So there's certain tricks that you can do, right, that you can even qualify yourself, right? Now, the key here is you have to be a U.S. citizen, right? So you would have to get your citizenship, right? After you get your green card, inshallah, and all these things. If you're a US citizen and you came from overseas, you didn't live here too long, and you did not work, both the father and the mother, children of parents that are in situations like this. My father was in a situation like this. He never worked a day in the US. We were able to get him a social security check, and Medicaid covered his Medicare at 100%, and he paid nothing, right? And we've helped a lot of other people do this. And then on top of that, what you can do in a situation like this, and this is one of our last slides, if you're Medicare and Medicaid eligible, we can give you an additional plan that doesn't cost anything as well with an insurance company that will give you more free benefits, such as dental, vision, gym membership, or whatever. And some of these benefits even include a credit card to go buy healthy groceries so inshallah you don't get sick and you're wise in how you use your money, right? So there's a lot of benefits out there that you could be eligible for that you just don't know about and you haven't tapped into, right? So there's a lot of things that you could be eligible for that doesn't require you to pay anything. So that closes out our social security, inshallah. So now we're going to go through Medicare, inshallah. Medicare, bismillah. This is not fun, is it? Are you guys, I hope I'm not putting anybody to sleep. Feeling good, inshallah? Alhamdulillah. You look energetic today.
Can we ask questions because we're moving to another
Sure,
section?
yeah, absolutely. Tell them. You have a question, go ahead.
So if husband and wife both working.
Yeah.
So, and they reach to the retirement age, so they can, the wife, spouse, let's say husband is making more money, so can wife be collecting the Social Security both, even the husband?
So you used to be able to do that, but they changed the law. So what people used, one of the collection strategies is that I'll collect from my spouse and allow my amount to increase. And then once my amount increases the highest, then I'll take mine. You can do that in another circumstance. You can't do it if you're both alive. The only way you can do that is if it's under survivor benefit. So let's say, for example, your spouse passes away. You can collect it as a survivor benefit and then allow your benefit to increase. That's the only way to do that. But again, there's also other collection strategies. To be honest with you, if we were to sit here and answer questions about collection strategies, we'll probably be here until, Fajr or something like that. Yes, brother.
I understand that, you can answer everything, you choose whether to answer or not.
Okay.
But what happens in the case when one spouse dies at the age of 50?
Yeah.
So when the other spouse, the surviving spouse, reaches the collection age,
Mm.
will he or she be able to elect from both?
They can collect from the survivor benefit at the age of 60. So once that spouse reaches 60. Now what you also have to consider is if that spouse died at the age of 50, you have to go back to that page of Social Security is figuring 35 years of income.
Yes.
So if they died at the age of 50, maybe not. Highly doubt that they worked for 35 years.
But whatever is done.
Yes.
It doesn't have to be 35 years.
Yes.
Thank you.
Yeah, I had a quick question. If the children, say if they were under the age of 18, are they eligible if one of their parents died?
Absolutely. So that survivor benefits, very good question, inshallah. So survivor benefits would be available also for children under the age of 18. And they collect immediately. With them, it's different. It's a different story. It's not like, if they delay. No, children, there's no delay. They just collect immediately when the parent passes away, if they're underage. Yes.
I have a question about SSI.
Okay.
If someone worked and accumulated what you were speaking about in receiving Social Security, but also is eligible for SSI for if they're eligible because of a disability.
Yeah.
What happens in that situation?
So it doesn't impact your.
Can you repeat the question?
So his question is if you're eligible for SSI, Social Security income, okay? If you're eligible, that's usually for people that are disabled. And also SSI would go towards that example of people that I told you that didn't live in the US or didn't work in the US but are US citizens. That's that amount that they get, that 700, 800, 900 or whatever it may be, it goes up every year. That is included in SSI, right? So this is not actually your Social Security benefit that you earned from working, but this is, more so for special circumstances. So it doesn't impact it at all, right? And when it comes to Medicare and Social Security, you can qualify for Social Security and Medicare before the age of 65 or the 62 if you are disabled, right? So first, number one is if you're disabled, you become eligible for SSI, right? You get a Social Security check. And then, but that doesn't mean you can't work, right? You can work to an extent, okay? Now, if you work a lot and you prove that you can work and earn a great income, then you would lose that, that SSI, right? So you can work, you can earn that SSI, and then what happens at that point is 2 years from that moment, then you become Medicare eligible. So you can be Social Security and Medicare eligible before the age of 62 or the age of 65. Yes?
What makes you eligible for SSI?
If you're disabled,
Okay. So
right? Or like say, for example, your specialty is in a specific career. Let's say, for example, you're a construction worker, right? And you have a really bad back problem, then you can't work anymore, right? If you can prove that, you have to have doctors and all of that, right? If you can prove these things. Now, unfortunately, there's a lot of SSI and disability fraud where people take advantage of the system, right? I've seen many of it, right? I see people, mashallah, very strong and able to work, but they don't, right? I mean, us, at the end of the day, to be honest with you, as Muslims, we're ethical, alhamdulillah. We're very careful about ensuring that the money that comes into our household, inshallah, is earned.
But
Brother Osama, if you wouldn't mind repeating the question for the sake of the audience that's
Sure.
coming in from Facebook and YouTube.
So his question was,
What
I gave you the
makes
answer, but for some
what
reason-
makes you eligible for SSI?
Oh, what makes you eligible for SSI? Yeah, so usually it's going to be disability. And there's other types of SSI, which is low income and old age, right?
Okay.
So for example, like I said, in the circumstance where someone's older, and they didn't work here and they qualify for Medicaid, and the Medicaid would cover the cost of their Medicare, and then they would also qualify for benefits.
So that's an income-based qualification for SSI, that they don't have an income. Is that how they qualify? Because you had made a statement that if you have never worked in the US, you may
So
be
that's,
eligible.
yeah, so that's old age and inability to work,
Okay,
right? Which also goes into disability. So inability to work.
okay, thank you.
Okay. Bismillah, let's continue to Medicare, so that we can try to finish.
And if we could please send a quick reminder to the folks that are dialing in that they too can post questions,
Yeah,
and we'll read them out to you.
So for those of you that are on this YouTube, you can ask your questions as well, inshallah, and the brothers will read them to us and we'll answer them, inshallah. So without further ado, inshallah, let's begin Medicare. Can that see the screen?
I beg your pardon? Yeah.
Okay, so the first thing you need to know about Medicare is the ABCDs of Medicare, a bunch of alphabets that we're going to throw at you. So we're going to explain it, inshallah. So when you go on Medicare, there's 4 letters that you need to be aware of that are going to be constantly used, and you need to know how they're defined. Okay, number 1 and number 2 is your original Medicare. Okay, A and B. C is going to be when you essentially drop Medicare as your primary insurer, and the private insurance company is going to be your primary. D is D for drugs, so that's going to be your prescription drug coverage. Okay, so now what we're going to do is I'm not going to explain it on this slide. I'm going to go into each one, inshallah, and try to educate you on each one. Your original Medicare benefits is Medicare Part A and Part B. Medicare Part A is your hospital insurance. Anytime you're admitted inpatient in a hospital, skilled nursing facility, hospice, or home care. This doesn't mean when you go to the hospital to the emergency room or observation status, this does not count. This is being actually admitted into the hospital. That other stuff, emergency room, observation status, this falls under Medicare Part B. Medicare Part B is your outpatient care. Okay, so this is doctor office visits, surgeries, Allah protect us, cancer treatments, all these types of things, medical equipment, lab tests, everything that's not being admitted into the hospital is essentially Medicare Part B. So Medicare Part A and Part B is where you get that red, white, and blue Medicare card. Okay, the red, white, and blue Medicare card has your name on it, your Medicare number, and it has Part A and Part B. Okay, so now we're going to go over how much Part A and Part B costs. Medicare Part A could be anywhere between $278 to $506 a month. Okay? This is for people who do not have 40 credits of working, that did not pay that 1 point some percent towards their Medicare. Okay? If they did not, and they did not qualify for Medicare benefits, then they will have to pay somewhere between $278 and $506. However, the majority of the people in the US, the people that worked and have 40 credits, as long as you have 40 credits, your Medicare Part A is automatic at the age of 65 and it's free, there's no charge. Okay? So the only reason why you would pay anything for Medicare Part A is that you didn't have enough credits. Medicare Part A, as we said, is your hospitalization coverage. So how does it cover you? Okay. The worst part of Medicare Part A is the per admission deductible. You have a $1,632 deductible every time you get admitted into the hospital. So you get admitted to the hospital, you leave, and you go back again a month or two later, you're gonna have to pay $1,632 again. Okay? Now that will cover you for a full 60 days. Now the thing is, there's no hospital in the US that wants to keep you for 60 days. They don't want to even keep you for 3 or 4 or 5 days. They're trying to get you out as soon as possible, right? Especially for Medicare beneficiaries. Why? Because Medicare has a payment system. They're called DRGs. They break them down into diagnosis-related groups. So what that means is Medicare has already predetermined, if someone gets admitted to the hospital for heart, we're going to pay this amount. If someone goes into the hospital for a lung issue, for cancer, for surgery, for this, we're only going to pay this set amount. So what does that mean? Let's say, for example, Medicare has said the DRG for a heart-related issue, a heart attack, is $200,000 because they know they're going to have to do an open heart surgery. The amount is $200,000. Now the hospital knows I'm only going to collect $200,000 for this patient. So if the hospital knows I'm collecting $200,000 for the patient, the hospital has to pay for your room every day you're there. They have to pay the nurses, they have to pay the doctors, they have to pay the surgery and all of these things, right? So what are they going to try to do? They're going to try to minimize the care for you to do what? To increase their profit. So if I can take care of you, the hospital, if I can take care of you in 3 days, I'm going to take care of you in 3 days. Why would I keep you for 15 days? I'm losing from the $200,000 that I'm receiving from Medicare. Unfortunately, in the US, hospitals are businesses. They don't really care about the patients too much. Okay? The doctors probably do, especially mashallah Muslim doctors. But the hospitals, it's a business. They want you out as soon as possible. Right? So what happens here is they're trying to get you out. Just think about it. If you get a contractor, right? And he tells you, okay, the amount is $50,000 to do my basement, right? He's going to try to find ways to keep his costs down as much as possible so he can get to keep more of that $50,000 for his pocket, right? This is likewise with how the hospitals work, okay? So Medicare already has set values that they're going to pay for all things that you could be admitted for. So what happens here? They're probably not going to want to keep you that long. Now, if you are there for more than 60 days, you have to pay a $408 copay every day you're in the hospital for 61 to 90 days. That's if you have Medicare benefits just by itself. 91 to 150 days, you have an $816 copay every single day. Beyond that, Medicare is not going to pay a penny for you anymore. They're like you're on your own. Okay? But again, the more realistic thing, the thing that we should be worried about the most is that $1,600 copay daily. That's the worst part about it. Okay? Skilled nursing facilities. Let's say, for example, the hospital wants to get you out. You don't need care by the doctors anymore. You're just not ready to go home yet. Okay? You had an injury or something like that. You need around-the-clock attention by nurses. Medicare will cover the first 20 days at 100%, and then you have a $204 daily copay if you need further attention between 21 to 100 days. Beyond that, that turns into long-term care, and Medicare does not cover. So that is your Medicare Part A benefits. Medicare is your hospitalization. That's the main thing that you need to know about it. Then we jump into Medicare Part B, the second part of what your Medicare card does for you. Your Medicare Part B is, for the majority of the people, going to cost them $174.70. Now this amount also goes up and it goes down with regular costs. Now if you see this chart right here on this side, This chart shows you that you could potentially pay more for Part B if you earn more, right? It shows you, like, say, for example, if you earn between $103,000 to $129,000 a year, it goes up to $244 a month, right? So I've seen people pay over $500 a month for their Medicare Part B. They just, mashallah, they earn a lot of money. So essentially, when you're older, the government wants to penalize you for making more money, right? So they're going to make you pay more for that. But on average, from what I've seen, most of the people on Medicare retired and they're paying $174. How does Medicare Part B work? Okay, Medicare Part B, you have an annual deductible of $240. Okay, you have an annual deductible of $240. Once you pay that deductible, this is probably the smallest deductible you've ever seen, right? Especially if you've been on an Obamacare plan, the deductible is like $7,000, $8,000, right? So $240 is not a big deal. Then Medicare pays 80% and you have to pay the remaining 20% of every bill. Now you may think, 80% is a lot. Oh, I only have to pay 20%. Sure, but any insurance policy you've ever had, be it on the marketplace or an individual policy or even through an employer, you've always had something called a maximum out of pocket. A maximum out of pocket is when you reach it, then every medical service is covered at 100%. Now no more. No more copays, no more deductibles, nothing. Medicare does not have a maximum out of pocket. It is unlimited risk. So that 20% is 20% of what? 20% of an outpatient surgery, that's $300,000. You have to pay 20%. If, may Allah protect us, we get cancer, you have to pay 20% of every chemotherapy, right? 20% of every doctor office visit, of every specialist visit, of every lab test, of every MRI, of every x-ray, of every this, every emergency room, every outpatient service, 20% with no maximum out of pocket. So it's unlimited risk. So this is of the worst parts of Medicare Part B. So as we see, Medicare Part A and Part B doesn't give you much coverage. Now, what things that Medicare does not cover, doesn't cover prescriptions, so you'd have to get a Part D plan for that. It doesn't cover dental, doesn't cover eye examinations. Now, when it comes to eyes, the thing that it does cover is ophthalmology, like a medical eye doctor, right? But like for cataract surgeries and things like that, macular degeneration and all these types of eye issues. But for just optometry, is not covered under Medicare. So that is Medicare Part A and Part B. Now the issue with that is we need a solution for it. So we're going to go over the solutions. But when can you sign up for your Medicare Part B? Your Medicare Part A, you don't need to sign up for. It's automatic. Especially if you worked 40 credits. It's automatic. You turn 65, you're automatically on Medicare Part A. Even if you're working and you have employer coverage, you're going to have Medicare Part A. Your Medicare Part A start date is the month when you turn 65. Okay? Now your Medicare Part B, you can delay it if you're working and you have credible coverage. So you have 3 months before your birth month and 3 months after to sign up for Medicare Part B. If you don't sign up during that time period, you have to wait until the open enrollment period, which is at the beginning of the year, and you won't be able to start your Medicare benefits until July. So you're delaying your Medicare, and when you delay your Medicare Part B without credible coverage, you will be penalized by the government. And that penalty is monthly for life. So be sure when you're eligible for Medicare Part B to sign up for it immediately. Yes, sir.
What do you mean by monthly for life?
So they'll take a percentage, like say for example, your Medicare Part B costs $174, that's the base. So they will add a percentage for every month you don't have it. So your penalty might be $20 a month if you didn't have it for 5 months, right? It might be $50 a month if you didn't have it for a whole year or 2 years. So they're going to penalize you every month. So when you're eligible for it, you should get it.
Okay, but if I'm working and I have a
If you're working, you have credible coverage.
Okay.
Therefore, you can defer your Medicare Part B benefits.
65. 65.
65 is when you're first eligible. But again, if you're working or you have credible coverage, or even if you have your own group plan, you're self-employed, that's credible coverage. So you'll be fine. So there's 2 solutions to Medicare, right? As we saw, Medicare doesn't cover much, right? You have to pay a lot. You have to pay $1,600 every time you go to the hospital. You have to pay 20% of every single outpatient bill. So what do we need? There's 2 solutions. Solution number 1 is to keep Medicare as your primary coverage and to take a supplement plan, a Medicare supplement plan to do what? To supplement the benefits of Medicare, right? So the supplement plan comes in and it covers essentially what Medicare does not cover. Option number 2, we're gonna go over that. So we're gonna go over option number 1, which is the safer option. I'm not saying safer because this is what I recommend. I will never, whenever you sit with one of us, if you choose to seek our assistance, again, any of our services are always free of charge, we don't charge anything. But if you ever were to sit with any of us, we train our people to educate and to teach, right? We don't recommend certain things. We educate you to the point where you can make the decision on your own, inshallah. Okay? So option number 1 is safer because there's less things that you have to worry about, and I'll explain. So the most popular Medicare supplement plan to supplement Medicare. Now when you have Medicare as your primary insurer, there's no network. There's no more HMO, no more PPO, no more restrictions on what doctors and hospitals you can go to. You can go anywhere in the US. Wherever Medicare is accepted, you're covered the same way. Okay? So when you do that and you take this Plan G, it doesn't matter what company you get it with, you're getting the same benefits. So if you take Plan G, Medicare Supplement Plan G, to supplement your Medicare, to work alongside your Medicare, it will cover the $1,632 copay every time you go to the hospital. So what does that mean? That means if you go to the hospital 20 times in a year, may Allah protect us, you'll never pay a penny. If you're there 61 to 150 days, and you have those ridiculous copays of $400 a day or $800 a day, it will pay that as well. So basically, if you have Medicare Supplement Plan G, anytime you go to the hospital, you never pay a penny. You know for sure, I have no medical bills. Likewise for the Medicare Part B for your hospitalization, right? So for hospitalization, for your outpatient care, for doctors, this was, Medicare Part B was doctor office visits, outpatient surgery, all of that. Everything that's not being in the hospital. That's where you have to pay the 20%. Now the only thing the Medicare Plan G plan does not pay is the deductible, the $240 deductible. But again, that deductible is very small, it's not a big deal. But once you pay that deductible, $240, Medicare Plan G, as you see G with a check mark, it will cover that 20% unlimited, right? So if you have an outpatient surgery, like we said, that's $300,000, open heart, whatever, it's going to cover it at 100%. Every cancer treatment, every lab work, every MRI, every this, every emergency is going to cover it at 100%. So if you were to sign up for Medicare Supplement Plan G, you know what you need, as a senior, you know what you need to budget for your income. Whatever the monthly cost is, it's anywhere between $100 and $150 a month, depends on your age. So this one depends on your age for how much it costs, right? Now you know that I have peace of mind. I pay a little bit more for my insurance, but it's covered at 100%, right? I don't have to worry about it. Now, if you take Medicare Supplement Plan G, it doesn't give you any additional benefits to Medicare. It's only supplementing what Medicare does not cover. So if you want prescription drug coverage, you have to take Medicare Part D. Medicare Part D is essentially a prescription drug plan, right? So what we do is, anybody can do this. You go to Medicare.gov, they have a system where you can put in all of your medicines and it will tell you which prescription plan will be best for you. Prescription plans, honestly, now some of them are even free. Like the insurance company gives it to you for free. It could be anywhere between $0 to $15 a month, depending on what your prescriptions are. And we can help you figure out which plan will cover your prescriptions the best. Now with Medicare Part D, if you don't have this plan, like Medicare Part B, they will penalize you if you choose to not have it. If you're eligible for it and you don't have it, they will penalize you for not having it. Likewise, also with Medicare Part B, whatever plan you choose, if it's $5 a month or $10 a month, if you earn more income, they're going to add a penalty of $12, $31 a month to it. So Medicare doesn't want you earning money while you're getting Medicare benefits, unfortunately. Okay? But again, they're higher amounts, they're like over $97,000 or this. So these are just things that you need to compare when you're looking into Medicare Part D plan. The monthly premium, the deductible, if there is one, co-pays and formulary. Again, that's something that we do automatically through their system. It's a non-biased system that you put in the prescriptions. Now, if you don't take any prescriptions, does that mean I shouldn't take a prescription plan? No, because you can only sign up for a prescription plan once in a year. Outside of the enrollment period, you can't sign up for it. So what happens in the middle of the year, you get sick and you need a bunch of prescriptions. Now you can't have a prescription plan until the next year, right? So if you don't take any prescriptions, we still recommend a prescription plan. Like I said, some prescription plans are free. They don't cost anything. Or they're $2 or $5 a month. And they're actually really good prescription plans. Even people that take a lot of medications, we still sometimes recommend for them the $0 plans or the $5 plans. They work really well. And some of these $0, $5 plans, they have $0 copays for many generic medicines. So it works out very well for many people. So there's different tiers. I mean, this, again, this is all resolved when you look it up on their system. We spoke about the late enrollment penalty if you don't enroll into your Medicare Part D plan. So how the late enrollment penalty works is, let's say, for example, you go 2 years without a prescription plan. You say, what do I need a prescription plan for? I don't take any prescriptions. Well, if you don't have it for example, 20 to 24 months, the penalty is about 35 cents a month. So you're adding a penalty of about $8.40 a month for life. The penalty doesn't go away. Not that much, but it's frustrating to have to pay something that you don't have to, especially if there's prescription plans that are for free, right? If it's for free, just take it. It doesn't make sense not to. So that was the first solution. If you have Medicare, the first solution is what? You keep Medicare as your primary coverage, so you can go, you have the freedom to go to any doctor. You don't need any referrals to see specialists or anything like that. You're covered the same in Illinois as you'd be covered in any other state in the US, okay? The Medicare Supplement Plan G is gonna cost anywhere between $90 to $150 depending on your age, sometimes even higher if you're older, in your late 70s or 80s. But it's a set amount that you pay, and you know I don't have medical bills beyond this, right? And I don't have to worry about, is this doctor in network, is my doctor out of network? Like, you know, sometimes there's a lot of hospitals and doctors, they're in network with the insurance, but then the next year they're not in network anymore because the contract expired. You're never gonna have to worry about that issue when you're on Medicare, right? So it's the most peace of mind plan, but it may not be for everybody. So that's why we have solution number 2. Solution number 2 is a Medicare Advantage plan. Now, the Medicare Advantage plan, essentially what happens here is majority of these plans are free. They don't cost anything. That's why, you know, especially us in the Muslim community, we love free stuff, right? So we love going for the free plans, alhamdulillah. So when it comes to these plans, that what happens, how is it free? Many people ask us, how can I get hospital, medical, and prescription, and drug coverage, and all these things, how can I get it for free? Well, you get it for free because what happens is, step 1, the federal government, they pay the private insurance company that's offering this coverage. And then that private insurance company gives you the benefits, right? So first and foremost, what happens? Medicare is now not responsible for you anymore. Medicare is basically saying, I don't have to pay for their medical bills anymore. Take them away from me, right? Even Donald Trump, when he was the president, he was made an executive order to get more people on Medicare Advantage plans so that the private insurance companies can run them, right? Because insurance they have a big lobby in the US. They want to make their money. They don't want universal health care or anything like that, right? They make a lot of money, right? So guess what? If you're paying a Medicare supplement plan, you're paying the private insurance company around $100 to $120 a month. What's the most the insurance company can collect from you? What? $1,200, $1,300, $1,400 a year? But if you take one of their Advantage plans, the federal government is paying them around $15,000 a year per Medicare beneficiary. So guess what? If we have an insurance company, Aetna, Cigna, Blue Cross, which plan do you think they want you to sign up with? The supplement plan, where they're only collecting $100, $120 a month, or an Advantage plan, where they're not collecting any money from you, so they can easily market, come get this $0 plan. And I'm sure you've seen, if you watch TV, you see the commercials, or if you're around the age of 65, you're getting a lot of things in the mail where it says you can get all this coverage, dental coverage, vision coverage, all these things for free, right? Where are they getting this money from? You think the insurance companies, mashallah, they just care about seniors so much in the US where they want to hand out free coverage? Absolutely not. I always tell people, never be loyal to an insurance company, these big insurance companies. Honestly, if an insurance company knew you had cancer, they would love nothing more than to drop you off their insurance. They don't want to pay one bill for you. That's just the sad truth. That's how these insurance companies work. So what we do is we try to make sure to protect you from these types of things and put you with the best types of plans.
I'm sorry, so what's better, the medical advantage or the medical supplement?
Depends on your situation. So after I explain the advantage, you tell me which one you think is better for you. So with the Medicare Advantage plan, the insurance company is now your primary, okay? Your insurance company is now your primary. And when the insurance company is your primary, you're falling into HMOs and PPOs and all these different types of things. So you have to make sure your doctor's in network. Now, why do a lot of people like Advantage plans? Well, it doesn't cost anything anymore. Especially many people like, brother, I'm very healthy. I haven't been to the doctor, alhamdulillah, or hospital, probably since as long as I can remember, since I was maybe 18 and I fell and I scraped my knee or broke my leg or something like that. Mashallah, I'm in great health. Why should I pay for insurance? Yeah, why should you pay for insurance? Take an Advantage plan, right? So they take an Advantage plan, right? And some people, honestly, they can't afford $100 a month. They can't afford $120 a month. So there's no other option other than take an Advantage plan. So the nice thing about being on Medicare, in Medicare age, there is an option for you no matter what. If you can't afford it, then at least take an Advantage plan that's free. Because at least with an Advantage plan, these plans have maximum out of pockets. If you're just keep original Medicare, there's no maximum out of pocket. You have unlimited risk of what you can pay. So you should not be in a situation where you're just like, I don't want anything. I'll just take Medicare. That is not a very smart thing to do. You should take either a supplement plan or an Advantage plan. You try to figure out which one is going to be the best one for you. Now with Medicare Advantage plans, now maybe the way I'm making it sound is making you guys think it's not a good plan or something like that. No, some Medicare Advantage plans are very good, right? And it depends. Now there's no doubt the supplement plan is safer because there's no network, you can go anywhere you want or anything like this. Medicare Advantage plans, they give you other things. It's an all-in-one plan as you see here. It's like A plus B all together in one. So you have Part A benefits, Part B benefits, and the prescription drug benefits all in one at zero. But it's not the same type of coverage. The insurance company now creates the benefits of each plan. Like just for example, are we in Cook County here? Cook. So Cook County has hundreds of Advantage plans. Which one is the best for you, right? You have to look to see which one is going to work for you the best, right? Usually we'll recommend $0 ones that are PPOs, because what is a PPO? A PPO is a network that's going to give you a little bit more flexibility, a little bit closer to Medicare, but it's still not as, it still has a level of restriction to it, because you go out of network, you have to pay more, right? So what happens here? You can take either an HMO or a PPO plan. What are the benefits, what are the difference between the two? Now with HMOs, you can only stay in network. So if you choose to take an HMO Advantage plan, you better make sure that your doctors and your hospitals that you want to go are in network, or else they're not covered. They don't cover out of network. PPO will cover in network and out of network. Now I will say this, be careful from anyone who sells an Advantage plan and tells you this plan is free, it's going to cost you nothing, all your doctors are in network, and they never even ask you who your doctors were. All your hospitals are in network, and they didn't even ask you who your hospitals are. All your prescriptions are covered, but they didn't even ask you what prescriptions you take. And you have no copays. This is not true, okay? There's some very limited plans that work like this, but these are for dual people, people that have both Medicare and Medicaid. Anybody who says that is just trying to throw you on a plan quickly and be done with it, okay? You need someone who's willing to help you. If you want to take an Advantage plan, the person who's helping you, they need to ask you, who are your doctors? What hospitals do you go to? What are the prescriptions you take? Because some Advantage plans may not cover your expensive prescriptions. There's some expensive, especially if you're insulin dependent, right? Or you take certain heart medicines that are expensive, like Eliquis or whatever it may be, right? Or you take some very expensive diabetic medications like Januvia or whatever it is. Some of these medications are very, very, very expensive, right? And you can pay a lot of money. So it's very important to choose these plans wisely and to do the proper research to choose these plans. Now the worst part of hospitalization, Medicare coverage is hospital coverage, right? You can have anywhere between a $250 to a $400 copay every day for like 5 or 6 days, right? Some plans are a little bit less, 3 days or something like that. But with that, it's very high. Now, luckily, there is a way for you to get an additional plan, which is actually very inexpensive, anywhere between $20 to $40 a month, that will help you cover this, right? But it's not a necessary thing to take, but it's important to know that the Advantage plans usually have high hospital copays. Now, remember, Advantage plans will have maximum amount of pockets. It could be anywhere between $4,000 to $8,000 a year, okay? Which is obviously very high. Now, if you take an HMO plan, the maximum out of pockets is less. Why? Because if you take an eligible plan, the insurance company knows you're only going to their doctors. We already know how much we're gonna pay them, because if you go out of network with a PPO, now the insurance company has to take an effort to negotiate with the doctors and the hospitals to figure out what your medical bills are going to be. When can you sign up for a change or sign up for a Medicare Advantage plan? You can only do it when you're first turning 65, when you're first Medicare Part B eligible, or during the annual enrollment period, okay? If you have an Advantage plan, if you're someone who says, I want an Advantage plan, these dates need to be on your calendar every single year. October 15th to December 7th. Every single year, this is the annual enrollment period. Advantage plans are only good for 1 year. If you have an Advantage plan in 2024 and you said, this is the best Advantage plan ever, guess what? That plan could be completely different in 2025. Because these plans are only contracted for 1 year. So you have to review it. There's been many circumstances where people say, oh, I love my plan, I'm just gonna keep it. Okay, the next year comes, they raise their copays by a lot. They don't cover some medications anymore that they covered the year before. It's very important to review it during the annual enrollment period, which is October 15th to December 7th. Now, this is something that we spoke about, brother, right? What happens if you leave your employer coverage, right, after the age of 65? Well, you have to sign up for Medicare Part B, right? You have a 60-day period now to sign up for Medicare Part B and to enroll into Medicare Part B, and to sign up for a Medicare Advantage plan or a Medicare Supplement plan. Okay? Remember, when you lose employer coverage, you have a 60-day window to sign up for a plan. Be very vigilant of that, and you could sign up for Medicare Part B online. Then we have the people that are Medicaid eligible, right? So just because you're a senior, right, and you have Medicaid, it doesn't mean you shouldn't take any other plan. Let's say I have Medicare and Medicaid, right? You can get more benefits. Actually, that's when Medicare Advantage plans could be even best, because everything will be covered for you. Almost everything will be covered, but then what else happens? You add dental benefits, you add vision coverage, and all of those other things. One other thing that I failed to mention is Medicare Advantage plans. They give you hospital, medical, prescription drug coverage, dental coverage, vision coverage, hearing coverage. They even give you sometimes an allowance to purchase over-the-counter medication. They'll send you a credit card, and they'll even send you a credit card sometimes to purchase healthy groceries. Why do you think they sent you a credit card to buy healthy groceries? Because it keeps you healthy and less to the doctor, so they don't have to pay medical bills, right? Unfortunately. So, but they do all of these things. There's a lot of these additional benefits that you could get, right? So this is something that you have to study. Every situation is different. But hopefully this gives you a good understanding of what you're getting yourself into, especially for the younger brothers and sisters here that know that their parents are in that age group. This is a good way to be able to help them. You know, because even when, before we started Ikhlas, and I used to work for a company, and we used to work with a lot of non-Muslims and stuff like that, people that's lived here for many years and stuff, they don't even know anything about Medicare. Medicare is a very difficult thing to understand, right? So these are basically the basics, and hopefully it gave you guys the ability to understand. Now, one thing I want to mention is Ikhlas has made a partnership with mywasiya.com. Mywasiya.com is a website where you can do your Islamic will for a fraction of a price that you would pay at what's it called? At a lawyer, right? So mywasiya.com is something that you can do a full Islamic will, inshallah, get it signed by, what's it called? Get it signed by witnesses, and it will work out for you to be able to get your Islamic will. So as you all know, the hadith of Prophet Muhammad sallallahu alaihi wasallam, don't go 2 nights without having an Islamic will, right? So even if it means that you go home tonight and you write one on paper, at least you have something in writing. Because and if you go to the website, they're going through construction right now. But this is also something that all of these Muslim scholars as well have approved to be a very good Islamic will. So be sure that that's something that you take care of. Sheikh Joe Bradford is the one who initiated this project of mywasiya.com. He's a big Muslim scholar, mashallah. He's a graduate from Medina University with a master's degree in Sharia, working on his PhD right now, doctorate, from the University of Malaysia. He's one of the most influential sought-after scholars when it comes to Islamic finance here in the U.S. He works with MJA, American Muslim Jurists of America, and all of that. And he also does Sharia compliant auditing for businesses, for Muslim businesses. So he's actually our Sharia compliance advisor for Ikhlas to make sure all of our dealings and everything that we do, inshallah, fall under Sharia compliance as well, inshallah. So with that, also, again, their website is not working right now, but inshallah, when they do, there's a 20% off the Islamic goal. Like I said, it's only $160 if you just put Ikhlas 20 in the promotion code. So now, alhamdulillah, we have completed, and we went over Social Security and Medicare. So alhamdulillah, we can take a deep breath, no more boring numbers, inshallah. But I want to give you all the opportunity to ask any questions. Also, the QR code that we have here will take you to our website if you would like to schedule a time to speak to one of us, inshallah, to assist you in any way. Again, there's no fees for anything that we do. We're just here, inshallah, to help also as well. So if you have any questions, feel free. I promised I would be done at 7:15, but I went a little bit over.
So brother, just a quick reminder for, again, those folks that have dialed in through Facebook or YouTube that they can post questions online. We've shared the Slido code as well as they can put comments in YouTube. We do have a question. Will this deck be available to the folks that are attending over here? Can you share it with them, the presentation?
Sure.
In a PDF or otherwise?
Yeah, if you guys want to, we can get a sign-in sheet or something like that. You can put your email, and we can email it to you, inshallah.
Excellent. Thank you.
Of course, brother.
And then I think you've also placed some materials back there
Yes,
if you want to maybe
so,
touch upon that.
Yeah, in the back, we do have some brochures of our services and the things that we do. So you can feel free to pick one up, and you can feel free to give us a call asking questions. I mean, one of the main reasons why we named our company Ikhlas, because, you know, the scholars, when they would write the books, you know, our Muslim scholars, when they would write their books, the first hadith that most scholars would write, you know, they would write a book on fiqh or whatever, on usul, whatever. The first hadith they would write would be what? إِنَّمَا الْأَعْمَالُ بِالنِّيَّاتِ. Why? It wouldn't be for the reader. It would be more so for the one who's writing the book, you know, the scholar who's writing the book, to remind themselves that what my intention is writing this book. Is it for me to get recognition for my work and this or that? Or is it for me to, inshallah, do it sincerely for the sake of Allah subhanahu wa ta'ala? And I remind myself of that niyyah. And inshallah, if there's barakah and blessing in this, then the knowledge will go. Right? So anybody who works with us, we have the need of us to remind ourselves, first and foremost, to serve our Muslim community, inshallah, with sincerity for the sake of Allah subhanahu wa ta'ala. So we're here to help, regardless of the situation.
And also, all this recording is on our YouTube channel with the PowerPoint as well. So if you wanted to review it again with this information, and you can review it on your own time with your family and friends. So if you have any question, of course, you have the contact for Brother Usman, Usama. And so inshallah, we can help you, inshallah.
So we also have Hakam here, one of our Ikhlas guys. He has his business cards. You can reach out to him if you have any questions, and if you want to ask me any questions. Because sometimes when it comes to Social Security and Medicare, there's health issues and there's money issues. So these are very private things. So if you want to ask him privately, sometimes I've had brothers raise their hand, brother, this is my situation, and they tell me all of their family. I'm like, brother, shh, come speak to me privately. This is not something you want to share in front of the community. So if you have any private questions, please come and see us privately. But if you have general questions that all of us can benefit from, please feel free.
So what services are free from you, and what is the?
All of our services are in the church.
So another question regarding these Medicare.
Mm.
So either you pick all the parts or whatever, or they manage?
Yeah, so either you have Medicare Part A and Part B with a supplement plan and a prescription plan, Part B, or you just have an advantage plan. But you still have to pay for Medicare to have the Advantage plan. Because remember, Medicare is paying the Advantage plan. So if you take the Advantage plan, you still have to pay that $174 a month. You still have to pay. But if you're on Medicare and Medicaid, you're dual, you have both, you pay nothing. Because usually the Medicaid covers the cost of the Medicare.
So there will be 1 month premium also there for Medicare?
Medicare always has a premium. They take it automatically out of your Social Security check, the 174. The Part A is free if you have 40 credits, but the Part B is 174 for everybody. Unless you make more money, then they're going to charge you more.
So what make you eligible for Medicaid?
What makes you eligible for Medicaid? Low income, less than $2,000 in assets, things like that. Now there are some things that don't count towards your assets, but again, I say sometimes if you're low income, low assets, just apply for Medicaid and see what happens.
Can you own a home?
You can. You can. If it's your primary home, yes.
Okay, and just a follow-up on that question. I've had a lot of people in the community ask me, and I'm not sure if you are familiar or not, I forgot what the act was, it's some recovery lien. Did you ever hear that if Medicaid pays for your medical or your nursing home or any type of service, that after you pass away, they can go after your home, for example, if you own a home? Did you hear anything? You're right.
Usually Medicaid is uncovered. I have to review that. I'd be interested to talk to you.
Yeah, because I'm an attorney, by the way. I'll talk with you a little later. But there's a lot of people in the community, especially the Muslim community, who have this understanding that they're receiving Medicaid.
I'd love to talk to you.
Yeah, it's a big issue, and they come to me about the wills and stuff. But we can talk.
Sure. Yeah. Yeah. No. Especially if you're a lawyer in the community, or someone who does like car insurance, or someone who's an accountant, or you're someone who helps people with their investing, Islamic investing specifically. We don't partner with anybody who doesn't do anything Sharia compliant. So if you're someone who does Islamic wills, like proper Islamic wills, right? We only partner with lawyers and stuff like that do proper Islamic wills. So if you're someone who does things like this, we'd love to add you to our reference list, because alhamdulillah, we help people around the U.S. and we'd love to refer, because just like I was talking about my wasiyah, that's not for everybody, right? People that have, that's more so for like simple, basic people that don't have much assets. But lawyers are very much needed for trusts and wills and estate planning, very, very much so, you know, especially in more complicated situations. So if you're a professional in that sense, we'd love to network with you so that we can benefit the Muslim community as a team.
I had a question about Social Security.
Yeah.
So if you stop working, say at 60, you're not like
At 16?
60,
Oh, 60.
and then your full retirement age is 67.
Yeah.
So every year until 67, your average goes down. Because
No, not necessarily. If you worked for 35 years,
Yeah.
then no, they're only going to take 35 years of income.
The highest.
And they're going to take the highest out of the 35. So let's say you work for 40 years, right? They're going to take the highest out of that. So let's say out of the 40 years, you had 1 year where you made 20,000, but the rest of the years you're making 100,000. They're not going to count that. They're going to take the higher ones. But may Allah allow you to retire earlier.
it's not for me.
So when it comes to Medicare, and at 65, would you be contacting the Medicare.gov or they be contacting you to start?
So if you're already collecting Social Security benefits before the age of 65, usually Medicare will send you your card automatically. If you're not collecting Social Security, you need to contact Medicare. You should, if you're 50, there's no reason why you shouldn't have an account on SSA.gov to begin planning, okay? I have an account on SSA.gov to see how things are going, right? So it's a very, doesn't hurt you to do it, it just helps you plan. Yes, brother.
What are the must do if you're turning 65? It looks like that's a pivotal point for you to make some decision.
Yeah. The must do is if you're not collecting Social Security to try to figure out when you want to collect Social Security. If you're not working, to sign up for Medicare Part B 3 months before your birth month. If you are working, you don't need to do anything because you just defer your Medicare Part B. I definitely would advise speaking to a professional that will help you without charge, because this is not something special that we do without charge. People that do what we do, they shouldn't be charging in the first place. Yes?
For SSI, for seniors, right, 65 and over, what is the age they should apply? They are US citizen, requirement is they have to be US citizen and they haven't worked 40 hours in US. So what age they should apply for SSI? Because the senior disability, right?
Yeah. It doesn't matter.
So they don't have to wait 67.
One of the best things to do is to actually go to the Social Security office. I'll be honest with you, with my father, it was the first time I learned about it. This happened several years ago. Rahmatullah alayhi, he passed away. But this happened several years ago. I went there. He was like, "Oh, does your father live with you guys?" Like, yeah, okay, we're going to put that he pays rent. This is the Social Security person, right? And then this. So they said, okay, at that time, he's going to qualify for $700 a month. And then he has Medicaid, so that's going to cover the cost of his Medicare. So sometimes you'll have some really, nice people at the Social Security helping you.
Nowadays, Social Security office is completely different. Like,
Yeah, it
they
is.
don't let you in. You have to have an appointment.
You can set up an appointment. My advice is to set up an appointment. If you're in a situation like that, you want to try to get the best case scenario. I think that amount for people is going up to around $900, if not more. Yeah. Very good.
Brother Sama, I know this is not sort of the topic of the day, but your company also offers, I believe, Sharia compliant life insurance and some other products.
Yeah.
From a Sharia point of view, if folks are interested, maybe you could touch upon that as well.
So we do offer Sharia compliant life insurance. So how that works is, first and foremost, there's differences of opinion in life insurance generally speaking, okay? The most popular opinion is that life insurance is haram, right? And with that opinion, in the 1940s or 1950s, I don't remember, one of the great scholar, he was actually a scholar in the Hanafi school, his name is Sheikh Mustafa al-Zabqa. Sheikh Mustafa al-Zabqa, he came up with a fatwa during that time, before even now as big as life insurance is, that all life insurance is halal. Now, us at Ikhlas, we don't follow that opinion, that all life insurance is halal. In 2018, Dr. Ma'an al-Quda, he's one of the scholars, jurists for American Muslim Jurists of America, AMJA. And he made a fatwa at their annual Imams conference where Imams gather annually at AMJA and they discuss contemporary fiqh issues. He made a fatwa that life insurance is halal based off of certain circumstances, right? Now his fatwa, I met with him as someone who's in the insurance industry for about over 15 years. I met with him and I sat with him and we discussed. I didn't tell him to his face that I disagree with him or anything like that, but I didn't feel comfortable. But he has his opinion. He's a scholar. It's a valid opinion. I personally didn't follow it until we met Sheikh Joe Bradford, and his opinion was one that we, especially working in the insurance industry, we felt very comfortable with. And again, he's the one who vets all the insurance companies that we work with and the policies that we sell. So the policies that we sell, there's no interest in they are not interest-bearing contracts. The insurance companies they cannot be any insurance company. It cannot be a commercial insurance company. It has to be either a mutual company or a non-profit life insurance company. Because these are probably the closest thing that you're going to get to capital as possible, right? With a mutual life insurance company, it's owned by the policyholders. So the policyholders is the main concern, not the executives and the CEOs of the company. With a non-profit, it's non-profit. Actually, the non-profits are even better to get it from. So we're not here to tell you which fatwa is stronger, right? You can do your own research on that. We have the positions that are available. So if you are someone who feels that opinion is something that you're comfortable with, for sure we can help you with that. But we're very strict on the insurance companies that we use specifically for life insurance. And they have to be ethical. Their profit to debt ratio has to be proper. And if they fall under all of these categories, Sheikh Joe Bradford himself personally, he vets these companies and ensures all of that. And it would have to be two types of policies, either a term life policy or a traditional whole life policy. So if that's something that you're interested in or want to learn more about, even if you contact us, we're not going to convince you that something is halal or haram. This is between you and Allah subhanahu wa ta'ala, and that's up to you. So we do, it is a valid opinion amongst scholars that there are certain types, under specific circumstances, that certain life insurance policies can be halal. So we're very strict on the ones that we use, but again, that's up to you. But that's something, yes, that we do assist Muslims in the U.S. with.
Thank you.
Jazakallah, brother.
Allah subhanahu wa ta'ala bless your community, and jazakallah khairan for having us, inshallah.
Would you like to do some snacks over there from CD and get your cup of tea?
I just had a quick question. You were saying the Medicare companies disclose how much money they're gonna pay for one of their patients to the hospitals, and the hospitals try to take advantage of it by so what's the best way around that?
So actually, in the 90s,
Yeah.
they used to have competitions between doctors.
Right.